Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today, we're talking about something many people with diabetes experience at least once in their life: hypoglycemia, or low blood sugar. Doctor, before we go into causes or treatment, can we start very simple? What exactly is hypoglycemia?
Of course. I usually tell my patients that hypoglycemia is when your blood sugar drops too low to give your body and your brain the energy they need. For most adults, we call it hypoglycemia when the blood sugar is below 70 milligrams per deciliter. Some people may feel symptoms a little earlier, but 70 is the usual cutoff we use.
So it's like the body is running out of fuel.
Exactly. Your brain relies almost completely on glucose as its main fuel. When the level drops too low, the brain starts to struggle, and that's when symptoms appear.
Let's talk about those symptoms. Many patients tell us they feel funny or shaky, but it's not always the same for everyone. What are the early warning signs that people should watch for?
We usually think about two groups of symptoms. The first group is mild to moderate signs. These are things like shaking, sweating, feeling very hungry, a fast heartbeat, feeling anxious, weak, or dizzy, having blurry vision, or finding it hard to concentrate or think clearly. If the sugar keeps dropping, we move into the second group, which is severe symptoms. Then people can become confused, their speech may sound strange, they may act differently, they may have trouble walking, they can have a seizure, or they can even lose consciousness. When it reaches that stage, the person cannot treat themselves. It becomes a real medical emergency.
And what actually causes hypoglycemia? Sometimes people think it only happens if you skip meals, but guidelines list many different causes.
You're right. There are several causes, and the most common ones are related to diabetes treatment. For people with diabetes, low sugar can happen when they take too much insulin or when they take certain diabetes tablets, especially medicines like sulfonylureas. It can also happen if they eat less than usual, if they delay or miss a meal, if they exercise more than usual without adjusting food or insulin, or if they drink alcohol, especially on an empty stomach. There are non-diabetes causes as well, although they are less common. These include severe infection, kidney or liver disease, some hormone problems like adrenal or pituitary issues, severe malnutrition, or in rare cases, certain tumors that make too much insulin. But in everyday life, the majority of low blood sugar episodes happen in people with diabetes, especially those using insulin.
People often ask, how do I know my sugar is low if I'm at home and I'm not sure? So let's talk about home diagnosis first. How can someone recognize it at home?
At home, there are two main clues. The first is the way you feel. If someone who usually gets low sugar recognizes their typical pattern, for example, shaking, sweating, sudden hunger, or feeling anxious or weak, that is already a strong clue. The second clue is the glucose check. If they have a glucometer or a continuous glucose monitor and the number is below 70, that confirms it. We sometimes talk about something called the Whipple triad: symptoms of low sugar, a low reading on the meter, and improvement in those symptoms after eating. When all three are present, we are confident it really was hypoglycemia.
And how is hypoglycemia checked in the hospital or clinic? Is it different?
The basic idea is the same, but hospitals have more tools. We check a fingerstick glucose, which gives a quick answer. We may also send a blood sample to the lab. We monitor how the sugar changes after treatment, and we look for triggers such as infection, kidney or liver problems, or medication issues. If a patient arrives unconscious and we suspect low sugar, the team does not wait for lab results. We treat immediately and confirm with tests in parallel.
And now let's go to the part families always want to know. How do we treat low sugar right away at home? What do the guidelines say?
The main approach is very simple, and it's supported by major diabetes guidelines. We often talk about the 15 by 15 rule. If the sugar is low, but the person is awake and able to swallow, we give 15 grams of fast-acting carbohydrate. For example, 3 to 4 glucose tablets, or half a cup of fruit juice, or a tablespoon of sugar or honey, or a small glass of regular soda, not diet. Then we wait about 15 minutes and check the sugar again. If it is still below 70, we repeat the same step, another 15 grams of fast sugar. Wait 15 minutes and recheck. Once the sugar is back above 70 and the person feels better, they should eat a small snack, especially if the next meal is more than an hour away. That helps prevent the sugar from dropping again.
And what if the person is confused, very sleepy, or cannot swallow safely?
That is severe hypoglycemia. In that situation, we should not give food or drink by mouth because there is a risk of choking. Instead, we use emergency treatment. If glucagon injection is available, a family member can give it. Some people now have a nasal glucagon spray, which can also be used. And at the same time, someone should call emergency medical services. When the ambulance or hospital team arrives, they will give glucose through a vein. That usually brings the sugar up quickly. This is why we often advise people who use insulin to have glucagon at home and to teach their family how to use it.
Let's talk more about what happens when someone with severe hypoglycemia arrives at the hospital. What does the medical team usually do?
In hospital, treatment starts quickly. First, they give intravenous dextrose, which is concentrated glucose through a vein. Then they check blood sugar frequently for the next few hours. They correct dehydration and electrolyte problems if needed. At the same time, they work to find the cause. Was it too much insulin? Was a meal missed? Is there kidney or liver failure that slows down insulin clearance? Is there an infection or another illness? The patient is observed until the sugar is stable. If the cause is a long-acting tablet, such as a sulfonylurea, the person may need longer monitoring because the medicine can cause repeat episodes.
One thing people are often very afraid of is brain damage. How low does the sugar have to be, and for how long before the brain is in real danger?
That's a very important and sensitive topic. The brain is quite sensitive to low glucose. When sugar falls to around 40 or below and stays that way for a long time, the risk of harm increases. Short episodes that are treated quickly are usually reversible and do not cause permanent damage, but prolonged severe hypoglycemia can lead to seizures, coma, and in rare cases, permanent brain injury. This is exactly why education, quick recognition, and fast treatment are so important. We want to act before it reaches that stage.
So prevention is really the key. What are the most effective ways to prevent hypoglycemia in daily life?
Yes, prevention is the heart of good diabetes care. People can reduce their risk by eating meals on time, not skipping snacks when they take insulin, and planning ahead for exercise by bringing a source of sugar and sometimes adjusting doses after discussion with their doctor. It also helps to avoid drinking alcohol on an empty stomach, to learn your own early morning signs, and to check your glucose regularly with a meter or a continuous glucose monitor. We encourage patients to always carry some form of fast sugar, like glucose tablets. Having glucagon available at home or work is important for those at higher risk. And regular review of the medication plan with the diabetes team helps prevent both high and low glucose levels.
People often like very simple lists. Could we share some clear do and don't points for hypoglycemia?
Sure. Here are some do points. Do check your sugar if you feel odd, shaky, sweaty, or suddenly very hungry. Do treat low sugar quickly using fast-acting carbohydrate. Do follow the 15 by 15 rule and recheck after treatment. Do carry something sweet with you when you leave the house. Do tell friends, coworkers, or school staff that you have diabetes and how they can help you. Do talk to your doctor before changing your insulin doses. And do seek medical help early if your symptoms are not improving or if low sugars keep happening again and again. Now, some important don't points. Don't drive if you have symptoms of low sugar or if your sugar is below the safe range. Don't skip meals when you are taking insulin or tablets that can cause hypoglycemia. Don't drink alcohol on an empty stomach. Don't ignore warning signs and hope they will just go away. Don't give food or drink by mouth to someone who is unconscious. And don't wait until the problem becomes severe before asking for help.
That's very clear and practical. Could you give a short summary for our viewers, just to bring it all together?
Of course. Hypoglycemia means blood sugar that is too low, usually below 70. Early symptoms include shaking, sweating, hunger, and a fast heartbeat. If it becomes severe, a person may become confused, have a seizure, or lose consciousness. Mild to moderate episodes at home can be treated with the 15 by 15 rule. 15 grams of fast sugar, wait 15 minutes, then recheck and repeat if needed, followed by a small snack. Severe episodes where the person cannot swallow or is not fully awake need glucagon and emergency medical care. Prevention focuses on regular meals, careful use of insulin and tablets, planning for exercise, avoiding alcohol on an empty stomach, and always carrying a quick source of sugar. With good education and planning, most episodes of hypoglycemia can be treated quickly and many can be prevented.
Thank you, Doctor. And thank you to everyone watching Dr. Health Hub. Remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.